Hi guys, this is Oiza. Today we are at Onikan General Hospital, formerly Onikan Health Center. This facility caters mainly to obstetrics and maternity cases, but they are now gradually incorporating a number of other family healthcare services. We'll be meeting some of our background heroes here. I cannot guarantee how many because it's a very busy day at the facility and at the lab. As they expand, they tend to take on more roles. So let's see what we can get. But I promise to bring you something interesting. Okay, so here we are. We have Mrs. Bamigbade. I'm going to let her introduce herself and talk briefly about what she does. Hello, Mrs. Bamigbade.
I'm Bamigbade-Sanni Adebola. I'm a medical laboratory scientist and I specialize in hematology and blood transfusion service.
Thank you. So, we've talked a bit and I know you have quite the experience. How long have you been at this?
I've been in service for about 16 years.
Very impressive. Yes, thank you. So, over the years, what has it been like? How has the job changed, the landscape of it, or how has it changed?
Being a medical scientist is a player really, because over the years, medical laboratory science course is basically to determine or to diagnose disease or infection. Over the years, a lot of times we have been doing manual services. Whatever we want to investigate, whatever we want to do, we do manually. But as time goes on, presently, most of the machines have been automated. So most of our work now is being done automatically. So,
are there any other challenges that you faced, during the course of your career, from different places that you've worked in?
Not really.
Okay, good. So I'm just going to wrap up asking what your experience has been using our services at IkonsBiomed.
We've really been enjoying your services. As I said earlier, that most of our work now are basically done automatically. So one of your instruments is one of our hematology analyzer. So we run our full blood count on unit analyzer, which is one of Biomed instruments.
Thank you very much, ma'am. You're one of the oldest people in the game that we've met, so that's good. I should mention though that she had to make time for this. They're very busy today at the facility, so thank you very much, ma'am, for your service. Well done, and you're a hero. Thank you. Yeah. So I always try to deliver on my promises, and I said this is going to be interesting. I have another background hero with me, Mr. Fashanu. I'm going to let him introduce himself and just a bit of his title at his job. Hello, Mr. Fashanu.
Hello. Good morning. My name is Fashanu Anthony. I'm a medical lab technician.
Great. So now, just to give a bit of explanation. So, a very basic difference is that technicians are still undergoing a lot of training compared to scientists. So, what inspired you to get on this journey?
Okay. I started initially not really like I wanted to become a technician right from the background, because I came into the service as a tutor. Let me just say storekeeper. I came to the service storekeeper, but I rose to level 7. So when I get to level 7, I was told that that is the bar, the limit that I can get to. So I now sat down. I said, okay, what can I do next to forge ahead, so as to rise to certain level? So from my findings, I found out okay, I can still do the job of a medical laboratory. Then I started getting a research on how to do that. So from the research, I was told that okay, if I want to forge ahead, if I want to go to that school, I have to
Take courses.
Sit for another GCE.
Right.
So I said, okay, if that's I'm going to do it. I sat for another GCE. Then here I am being in medical laboratory.
Thank you for that, Mr. Fashanu. If there's one thing I can tell you about medical background heroes, laboratory workers, is that they're persistent, they're committed, and they're dedicated. We've had different examples of stories, but we haven't had this one. So I told you, very interesting. What's your specialty? What do you do in the lab?
Okay, we deal with sample analysis, like and serology. Serology is the hepatitis B, hepatitis C, VDR. Although there is more to it, like malaria, parasite, and all that. So the medical laboratory technician are in charge of the sample analysis of orders.
Yeah, thank you. So, what I enjoy doing this is meeting the variety of people who work and sharing them with you, so that once again you appreciate all that goes into healthcare. Mr. Fashanu, thank you so much. You're a hero. Thank you for your services.